Hi, my name is Dr. Siddharth Padia. I'm an interventional radiologist at UCLA. Interventional radiologists are physicians who do minimally invasive procedures using imaging guidance to treat a variety of conditions. And today we're going to talk about new treatments for elbow pain and tennis elbow. Now, when we talk about elbow pain, there are really two forms. The first one is arthritis of the elbow. Now, compared to knee arthritis and hip arthritis, it's certainly a lot less common. Most people who present with elbow arthritis typically have had some prior significant trauma to the elbow, like an accident, which then eventually developed into arthritis. The second most common reason to have elbow pain is something called epicondylitis. Now, this tends to be much more common than elbow arthritis, and this is associated with repetitive activities. Now, that can be repetitive activity in your daily job or playing sports and recreation. Now, when we talk about elbow epicondylitis, there are two forms. One is on the outside of the elbow, also known as tennis elbow. One is on the inside of the elbow, also known as golfer's elbow. Both of these are associated with repetitive activities. So for example, in tennis elbow, of course it's related to tennis, but more commonly we are seeing people playing pickleball present with tennis elbow, pain on the outside of their elbow joint. It's also associated with other activities such as people performing manual labor during their day jobs, often using a hammer, or even people in the office typically using their keyboards all day. Golfer's elbow is a lot less common than tennis elbow, but also is associated with repetitive activities such as being in the office and using your keyboard, and of course, playing golf. I'll show you one case of a patient presenting with tennis elbow. This is as a 78-year-old man who presented with elbow pain on the outside of his elbow for several years. He was an avid tennis player and then became an avid pickleball player. He reported his pain as an 8 out of 10. Now, he tried the conservative treatments such as non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen, and those worked, but they gave him temporary relief. He also tried a brace, but the pain returned when he took the brace off. He even underwent some injections with cortisone, and those, while did have some relief for a few weeks, kind of wore off after some time. He fills out this score called a PRTEE. This is a standardized scoring evaluation for people with elbow injuries, and it's a scale for pain, functions of the specific activities, and functions of your daily normal activities. And he had quite a high score. So for example, he had a pain score of 26 out of 50. So most of us have a score of 0 or 1 out of 50. Now, in terms of tennis elbow, what are the signs? So we'll typically have localized tenderness over the outside part of your elbow. We'll also have pain with extension of the wrist when you try to bend your wrist backwards. And you'll also have pain with flexion of your wrist when you try to bend your wrist forwards, also along the lateral aspect of your elbow. There are a variety of treatments for lateral epicondylitis, also tennis elbow. Most commonly, we do things on the left side of this chart. For example, just rest it or use ice. And that works extraordinarily well, but if you're in an activity where you want to resume, that can be problematic. Then the first line becomes medications such as ibuprofen or naproxen. While these work quite well, they often result in a temporary benefit, so they're not really long-lasting. Some people will get cortisone shots in their elbow, and that can also have some duration of effect in the lasting weeks to even months, but often the pain recurs. Now, on the extreme side, on the right side of the chart, is surgery. Surgery has been shown to be about 80% effective. It's typically done as an outpatient. The challenge with surgery is that it requires a rehabilitation and recovery time of several months where you're in a brace. So your arm is relatively immobilized for a long period of time. Now, when we talk about the cause of pain in tennis elbow, what happens is this is an overuse injury. And so we see micro tears in the tendons that attach to the joints. And as those tears start to heal, there's an inflammatory process in the elbow, and that inflammation is what causes the pain. There's a new procedure called EAE, also known as elbow artery embolization. This is a way to assess the inflammation in a different manner, and that's by an angiogram. And the goal of this procedure is to decrease the inflammation in the elbow joint, and by decreasing the inflammation, we can decrease pain. It's an outpatient procedure. It takes about 20 to 30 minutes. It can be done either with a light amount of sedation or even just with a local anesthetic, as the procedure itself is pretty much painless. We place a numbing anesthetic at the wrist, and we put a very small catheter in the artery in the wrist, the radial artery. The catheter itself is the size of a piece of spaghetti, and as we insert it into the radial artery, which is relatively painless, we guide it up into the artery, into the elbow, to take pictures. This is an example of a catheter going up the elbow, and we inject contrast dye, which is the black outline that you see of the artery. Now, in this patient, what we did is we put 2 circular BB markers on the skin on the outside, which you can see on the left side of the image, and that's where this person had pain. So what we're looking for are vessels or arteries that go to that area of pain. And so what we do is we take that catheter and we select out the branches that go into that area. And you can see that you have this web of tiny little arteries, but then you have this gray cloud puff of hyperemia, also known as inflammation. The goal of the EAE procedure is to decrease that gray haze because that is the inflammatory response. So once we're here, we inject a very small volume of tiny little plastic particles. These are smaller than grains of sand, and we're injecting 2 to 3 drops of these particles to decrease the flow in this artery. Now, the goal is not to completely block the blood vessel to stop flow, but simply to get rid of this haze at the end. And you can see the final result here where all the arteries are still there, but that inflammation is completely resolved. Once we take the catheter out, we place a wristband on the patient. They go home a half hour later. In that first patient that we did, who was 78 years old, he presented with an 8 out of 10 pain. And at 1 and 6 months, he actually reported 0 out of 10. He was fully functional, playing racket sports at 100% capacity. He also filled out this survey, and you can see the pain scores, the activity scores decreased to essentially normal at 6 months. And his letter to us was that his elbow, the treated elbow, felt pretty much normal. Other than him being right-handed, knowing that we treated his right arm, he wouldn't have been able to tell which elbow we even treated. Now, there is some data to support the use of elbow artery embolization. This was initially discovered in Japan at the University of Tokyo in 2017, who published their results. They looked at 24 patients in this trial. All these patients had quite a long duration of symptoms, so they had failed a lot of the conservative treatments such as joint injections and nonsteroidal anti-inflammatory drugs. The mean age was 52, so on a range of 35 to 66 years old. And many of these patients were involved in manual labor as their regular day job. Most, understandably, involved their right arm since most patients were right-handed. This is an example of one of their patients. You can see this gray area on the left side of the image. That's the hyperemia or the inflammation associated with tennis elbow. And after the EAE procedure, we have a complete absence of that hyperemia or that inflammation. You'll notice that the arteries, which are outlined in black, are still there. This is another scoring system that they used, and you can see over time that pain score, that dysfunction score, essentially returned back to normal within a few months, and it stayed normal all the way throughout their follow-up at 2 years. You can also see in the third row, their pain score, a 77 out of 100, dropped down to 11 out of 100 at 24 months. What I found most interesting was that many of these patients at baseline had undergone physical therapy, steroid injections, were taking medications. And you'll notice that 12 and 24 months, none of these patients were requiring any of these maneuvers to treat their elbow pain. So they were essentially fully cured. So when we talk about the treatment algorithm for lateral epicondylitis or tennis elbow artery embolization is something that can be considered when people fail conservative management such as rest, ice, nonsteroidal anti-inflammatory drugs. And thank you for your time. If you have any questions, you can reach out to us via phone or email.